Welcome to our discussion about renal and neurologic disorders. Right? So when we're talking about the renal system, our main component would be our kidneys. So you have two of them. They're in the posterior abdominal wall area. They're actually outside of the peritoneal cavity, which means they're not in the same system or the same membranes as like your abdominal organs. Your kidney has different parts. It has the outer cortex, which contains all the glomeruli and portions of the tubules, as well as the inner medulla. So there's just an image from A&P to take you back to what we're talking about here. Right. The functional unit of our kidney is called the nephron. Right? It's a tubular structure, if you remember back from A&P, that contains the renal corpuscle, and then it's highly vascular. This has the capillaries in it and the Bowman capsule, and this is what gives the filtration for the kidney. The proximal convoluted tubules have all the little tiny microvilli in there that gives them increased surface area so that we can have absorption. This is just an image to show you what we're talking about there. Alright, so when we're looking at kidney function, we're talking about the glomerular filtration rate. So GFR, this is how much the fluid or blood the glomerulus can filter through. The GFR is the amount of blood that comes through in 1 minute. Right? It should be around 125 milliliters a minute. Right? We can usually measure easier a serum creatinine level in our blood. This is directly related to how well the GFR is doing, so it can tell us inadvertently how our kidney function is. Right? If the GFR and serum creatinine are less than 20% of normal function, then the patient is in renal failure. Another indicator is our creatinine clearance. This is our best indicator of renal function. Usually it's harder to get a creatinine clearance than it is to get a serum creatinine, so they will only do it if those other values are abnormal. Creatinine clearance should be between 0.6 to 1.2 milligrams per deciliter. It's more difficult to get because it requires the patient to do 24-hour urine collection. So that means every time they pee during a 24-hour period, they have to collect that urine and keep it and then turn it all over to the lab for analysis. It's pretty difficult, especially if patients aren't in the hospital, to make sure that they get enough or collect everything. Alright, there's the calculation for it. I'm not going to ask you to calculate it, but just remember normal ranges and what the lab values tell us. Alright, so creatinine, we care about measuring it in relation to our kidneys because it's the end product of metabolism from our muscles. Alright, it gets filtered through the kidney. So if the kidney's not working, then the creatinine level is going to go up. Right? To monitor it, they're going to want to make sure they're looking at everything from the GFR, the serum levels, and then a 24-hour urine if we're concerned about kidney function. Right? Another complication that we should talk about in the renal system is urinary tract obstructions. Anywhere in the urinary tract can get blocked. Right? And when it does, it can cause an obstruction. The most common cause for this is a kidney stone, or renal calculi is another name for them. What happens then is that urine cannot flow through the system, and it's going to cause an increase in hydrostatic pressure, which will dilate whatever structure behind the obstruction happens, right? And that usually is what triggers pain. So for instance, if there's a kidney stone in the ureter, that's going to block urine from being able to go through. It will back up, which increases the pressure and will dilate the ureter and the kidney behind it. So kidney stones are also called nephrolithiasis, right, or renal calculi, are usually made of 3 types. There's calcium oxalate, which is the most common, struvite, or uric acid. Right? Sometimes if patients are getting kidney stones, so send the stones after they're passed for analysis to figure out what kind of type they are. Right? Some things put people at high risk for kidney stones, right? There are things that are going to contribute to the formation of stones. So high urinary concentration, if you have any of the stone forming components in the urine, then they're more likely to form into a stone, right? Urine pH. If your urine is more alkaline than usual, this makes it easier for crystallization to happen of calcium, which can lead to calcium oxalate stones. Low urine output, because if they're not peeing, then that urine is staying in the kidney and can cause stone formation. Any tubular problems, and then it can be a complication of other diseases, drugs, and diet problems. So calcium stones are most common. They're also the smallest. Patients can typically pass them on their own. They're most frequently in middle-aged men, especially if they have a history of a previous stone. It can be caused from high levels of uric acid in the urine, prolonged immobilization, because if someone's not moving, their bones start to break down and that will release calcium, and also hyperparathyroidism issues. Struvite stones usually happen after there's been an infection, particularly if it's caused by Pseudomonas bacteria. This causes the urine to be more alkaline, which allows the crystallizations to occur, and then they can form into stones. These stones are larger and they tend to form in the kidney or bladder area. Uric acid stones are whenever patients have a condition called gout, where they're unable to process uric acid properly. So then it builds up in their system and it can cause things like stones and joint problems. They need to avoid diets that are high in purines, otherwise they're just going to cause themselves pain and kidney stones. So they need to avoid foods like meat, fish, and poultry. All right. What happens is that since they can't get can't process the uric acid, it gets concentrated in the urine and then also in their blood, which can get deposited in the joints as well as form into stones. Right. Ulcerative colitis can also cause uric acid stone formation because of all the extra fluid loss and metabolic acidosis problems that these patients get. Right. So regardless of the type of stone, patients tend to have the same kind of symptoms. They experience pain. It's going to vary on which side the obstruction's on. All right, it's also going to matter where in the urinary tract it's causing an issue. So for instance, if it's lower in the tract, they tend to complain more of groin pain. If it's higher, they could be having flank or costovertebral pain. They sometimes also experience nausea and vomiting, and they very frequently have blood in their urine, which is hematuria. This is just an image. Stones can form in the kidneys, they can form in the bladder. They often most get stuck in the ureters to cause issues. Okay. Another common problem with our urinary system is urinary tract infections. Right? The medical word is cystitis, is whenever the tract infection is causing inflammation of the bladder. This is the most common site for urinary tract infection. Women get them more than men. Usually it's related to the fact that they have a shorter urethra, so it's easier for bacteria to travel through the urethra to the bladder. Common infections are caused by E. coli, Klebsiella, Proteus, Pseudomonas, and staph. Right? The pain that the patients experience, or the symptoms patients experience, are because of the inflammatory process that is going on with the bladder. And the common symptoms are frequency, urgency, dysuria, suprapubic pain, and low back pain. If the infection travels up the urinary tract system, it can lead to other problems, such as acute pyelonephritis. Right, this is when the infection is now in the renal pelvis, or interstitium of the kidney. It occurs most commonly in women, usually from a bacteria. Most of the time it was a lower urinary tract infection that has migrated up. Right. It can also be caused from urinary obstruction, reflux of the urine into the bladder, or from the bladder into the kidney, pregnancy, neurogenic bladder, such as with spinal cord injury problems, instrumentation to the urinary tract that has introduced bacteria, right, and even female sexual trauma such as rape. Acute pyelonephritis infection is most common because it's spread ascending from the ureters, right? So that's where it moves from the bladder and up the ureter and into the kidney. The inflammatory process causes white blood cells to penetrate into the renal area and cause inflammation, renal edema, and purulent urine. Patients will have symptoms suddenly, so they come on acutely. They include fever, chills, flank or groin pain, urinary frequency and dysuria, and then costovertebral tenderness. Chronic pyelonephritis is a little different. This is a recurrent autoimmune infection of the kidney that causes inflammation and scarring to the kidney tissues. Urinary obstruction prevents the elimination of bacteria, which then triggers progressive inflammation as the kidney gets into a cycle where urine can't get out, it gets obstructed, causes inflammation, makes scar tissue, and then it goes back through the cycle again. This can lead to chronic renal failure if it can't be taken care of. Right, the symptoms are similar to acute pyelonephritis, it's just a long-term problem. Another issue that we're worried about is acute renal failure. In acute renal failure, something is causing abrupt reduction in the renal system being able to function. Usually our first sign is oliguria, where urine output falls off and the patients have less than 30 milliliters of urine formation an hour or less than 400 a day. Lab-wise, we would see an elevated BUN and creatinine level. If we figure out the problem and diagnose it early, then we can reverse any damage. Right. This condition gets classified as pre-renal, intrarenal, and post-renal. So pre-renal is the most common cause of acute renal failure. It's from something affecting blood flow into the kidney. Right? So anything that has to do with blood volume loss or excessive bleeding can lead to renal or acute renal failure for a pre-renal cause. Right? So things like hypovolemia, hypotension, hemorrhage, and even low cardiac output. The glomerular filtration rate is going to decline because they're not going to be able to have enough pressure to filter blood through the kidneys, and then eventually the tubules do not get enough blood flow and they'll start to die off in a condition called acute tubular necrosis. Most commonly, acute tubular necrosis is caused by, next would be intrarenal failure. So what happens in intrarenal is it's a problem within the kidney itself. Right? The most common cause for that is acute tubular necrosis. So this is caused by ischemia, usually pre-renal problems that have progressed, right, where the kidney itself is not getting enough blood flow. Right, this can happen after surgery as a complication as well. The ischemia then generates oxygen-free radicals, and that triggers inflammation within the kidney. This causes cell swelling, which then makes the tubulars get obstructed. The obstruction causes an increase in the pressure, which makes it so that we can't filter blood and fluids through the kidneys and reduces the GFR. If it's not corrected, renal failure can happen within 24 hours. Post-renal failure is rare. What happens is something has to obstruct the urinary tract bilaterally on both sides after the level of the kidney. Right, it has to be blocking it for several hours, and the patient would have to have no urine output, right, or anuria, which means less than 50 in an entire day of urine. And then they also usually experience flank pain as well. So symptoms of acute renal failure, all right, regardless of the type, pre, intra, or post. Right, once they start to recover, they're going to go through 3 phases. Oliguria begins the first day after their event, right, so from whatever has triggered it, and it can last 1 to 3 weeks. Next up, they go through a diuresis phase. Diuresis is where we see an increase in volume, but it's not actually concentrating